Hello everyone, my name is Begum. Today I'm going to present my topic on high blood pressure. The objective of these presentations are understand the basic of high blood pressure, identify risk factors associated with high blood pressure, identify the age and gender distribution of patients with all, apply appropriate methods for diagnosis of hypertension, know the guidelines for treatment and prevention. The content of these presentations are definition and types of hypertension, causes of the disease and risk factors, signs and symptoms, diagnosis, treatment, and prevention. Let's begin with what is high blood pressure. High blood pressure, also called hypertension, occurs when the force of blood pushing against the wall of arteries is too high. As you can see in the picture, the force of blood pressing against the wall of arteries, and arteries carries blood from the heart to other part of the body. When the force of blood is too high, the heart has to work harder. Over time, this can cause serious damage to the arteries. According to 2017 guideline by the American College of Cardiology and American Heart Association, hypertension is defined as a blood pressure at or above 130 over 80 based on two different visits or multiple measurement. Blood pressure measurement consists of two numbers. The top number is systolic blood pressure, which measures the pressure in the arteries when the heart beats, and the bottom number is diastolic pressure, is the pressure in the arteries when the heart rests. In 2019, there were estimated 1.3 billion people worldwide have hypertension. Hypertension is a common condition. One in every three US adults have hypertension. Blood pressure is categorized into following level by American Heart Association. Normal or healthy blood pressure is less than 120 and less than 80 in diastolic pressure. Elevated pressure is 120 to 129 and less than 80. Stage 1 hypertension is 130 to 139 or 80 to 89. S- Stage 2 hypertension is 140 or greater than 90 in diastolic pressure. Hypertensive crisis, in this stage you have to seek emergency care and is greater than 80 and greater than 120 in diastolic pressure. There are two main types of hypertension. Primary or essential occurs by indirect causes which can be due to genetic or lifestyle. It develops over time and responsible for 90 to 95% of cases. In 2019, an estimated 516,955 people died that were a primary or contributing cause of hypertension in the United States. Secondary hypertension occurs by underlying causes such as use of certain medication or another medical condition, including kidney disease, thyroid problems, sleep apnea, preeclampsia, and responsible for 5 to 10% of cases. It usually develops over time. No, it usually develops suddenly, and several secondary forms of hypertension are more prevalent in resistant hypertension. Resistant hypertension is defined by the seven joint national community as the inability to achieve a blood pressure lower than 140 over 90 despite optimal doses of three or more antihypertensive drugs, including one diuretic. Hypertension is a silent killer because it often has no warning sign or symptoms. If your blood pressure is extremely high, certain symptoms may be felt, including severe headaches, nosebleed, vision problem, chest pain, difficulty breathing, irregular heartbeat, but these signs and symptoms are not specific. About 1 in 3 US adults are not aware that they have it. It can quietly damage your brain, heart, lungs, blood vessels, eyes, and kidneys if not controlled. As you can see here are some complications of hypertension are kidney disease, stroke, dementia, heart failure, coronary heart disease, preeclampsia, and blindness. Hypertension is a leading cause of cardiovascular disease and dementia, which is a loss of cognitive impairment. Hypertension is a chronic disease. It usually lasts lifetime, but it can be controlled. Hypertension may happen to kids, teens, older adults, and it can happen to any gender, but it's more common among older adults, especially men during pregnancy and African Americans. Also, patients with certain health conditions such as obesity, diabetes, kidney disease, and hyperlipidemia. As you can see in the first graph, the data from Nutrition Examination Survey from 2017 to 2018, the prevalence of hypertension among adults by sex and age. As you can see, the prevalence of hypertension is increasing with age, and men have slightly more than women. And the second graph is hypertension by race. The prevalence is higher, hypertension prevalence is higher among non-Hispanic black than non-Hispanic whites and Hispanic adults. There are different types of hypertension during pregnancy. Gestational hypertension, which develops after 20 weeks of pregnancy. Chronic hypertension, which develops before pregnancy or before 20 weeks of pregnancy. Preeclampsia is a sudden increase in blood pressure, usually occurs in the last trimester of pregnancy. Postpartum preeclampsia, which can be severe or life-threatening for both baby and the mother. Hypertension during pregnancy is the second leading cause of maternal mortality, which is almost 15% of just death in the United States. The factors raise high blood pressures are family history, increasing age, race especially among black individuals, unhealthy diet such as high saturated or trans fat, or lack of magnesium, calcium, potassium, low socioeconomic status, smoking, excessive alcohol consumption, physical inactivity, excessive sodium intake, sleep apnea, psychological stress, and some comorbidities associated are obesity, diabetes, kidney disease, and hyperlipidemia. The diagnosis, the diagnosis of hypertension occurs usually by measuring blood pressure at a doctor's office, at a pharmacy, or with a home monitor. It is important to monitor regularly, at least twice a day, to track the blood pressure level. It is also important to accurate measurement and recording of blood pressure, such as preparing the patient properly, using proper technique, such as before exercise or before taking medication. It is also important to check the accuracy or validity of the device and make sure the device is calibrated periodically. Because if the device does not give accurate number, then the hypertension level can vary. Healthcare provider may recommend to do some laboratory tests like urine and blood tests. Additional tests can be recommended to detect damage to the heart or blood vessel. Electrocardiogram is ECG detects electric activity of the heart. Echocardiogram is an ultrasound examination, and chest X-ray, and many more. Out of office blood pressure measurement. Ambulatory blood pressure monitoring, which is 24 hours monitoring, and home blood pressure monitoring are used to detect white coat and mask hypertension that monitor treatment out of the clinic. These two monitoring allow the physician to evaluate the patient's blood pressure based on multiple measurement or extended time outside the clinic, which can show the overall condition of the patient. Since our blood pressure changes throughout the day, it can differ in different setting or different time due to anxiety or depression or other causes. White coat hypertension patient might experience a sudden increase in their blood pressure at a doctor's office than at home or other setting. While mask hypertension patient can experience having a normal reading at the doctor's office than other time or other setting. Patients with this condition require special monitoring by the physician as they can be an increased risk of developing hypertension in the future. High quality blood pressure management is multifactorial. The awareness and engagement of patients, families, healthcare providers, and community. It requires the engagement and awareness since it has no warning sign and symptoms. Often has no warning sign and symptoms. High blood pressure also can be lowered through lifestyle changes or lifestyle modification, maintaining a healthy diet, such as using DASH diet, which is dietary approaches to stop hypertension diet that include food that are rich in potassium, calcium, magnesium. Is is a heart healthy. It includes heart healthy eating. Also, losing weight based on your weight and height, engaging in 30 minutes exercise per day, especially aerobic workout, limiting alcohol intake. It is recommended for men is 2 drinks and for women is 1 drink. Limiting salt or sodium intake, quitting smoking, managing stress through yoga, relaxation techniques, meditation, or other methods, getting adequate sleep. In addition, some people may need to take medication and antihypertensive drug therapy other than lifestyle changes to lower their blood pressure to a healthy range. According to the data of 2021, global treatment rate for men is 38, while it's 47% for female, and global control rate is same for both, which is 20%. Treatment for resistant hypertension. Resistant hypertension, as I said earlier, does not respond to that does not respond well to medication treatment. Resistant hypertension can be treated by improving medical adherence, using 24 hours ambulatory monitoring to determine if a medicine is working. Cardiac rehabilitation exercise program, lifestyle modification can also help to control resistant hypertension. High blood pressure can be prevented by making healthy choices and managing other health conditions such as obesity, hyperlipidemia, and other conditions. Some healthy choices can be made by eating a nutritious diet such as high fiber, fresh and vegetable, potassium, magnesium, calcium, avoiding food with trans fat and saturated fat, maintaining a healthy weight, increasing physical activity, quitting smoking, managing stress through meditation, relaxing, or listening to music, limiting salt intake, reducing alcohol consumption, regular monitoring, and also adequate doctor follow up following prescribed medication can prevent hypertension. Thus, by increasing awareness, yearly screening, proper treatment, and control of hypertension will reduce mortality and morbidity. For summary, try to answer this question to review the content of this presentation. What is high blood pressure? What are the signs or symptoms? What are the risk factors? What complication does hypertension cause? What is the treatment? What are the prevention? These are my references. Thanks for listening. Have a good day.